What new inventions have been created because of coronavirus? During the early weeks of the COVID-19 outbreak, the scarcity of ventilators spawned a number of inventions here in Italy, all aimed at maximizing the few resources available. At first it wasn't an invention, it was an emergency fix. At the Chiari hospital, the valves on the right, used for the non-invasive ventilators, were in very short supply. A local engineer and maker asked one valve and reproduced it with his 3D printer. Advanced 3D printers can make 100 of these valves a day, which in today's current emergency situation can be a literal lifesaver. Despite the initial news of legal actions, even the producer of the original item blessed this initiative. This wasn't an invention, but it was a good idea, using advanced 3D printers to create essential supplies in a situation of emergency. The next week, a former head physician of the Gardone Valtrompia Hospital, Dr. Favero, contacted Isanova, another firm that uses advanced 3D printing, with an idea to convert a certain type of quite common and cheap snorkeling mask into a non-invasive ventilator device. Isanova's engineers, with the help of the mask producer Decathlon, created the Charlotte valve, the yellow valve on top. Together the valve and the mask can work as an emergency CPAP, non-invasive ventilator in case regular, non-invasive, ventilator headsets are not available. Usage by the patient is subjected to the acceptance of use of an uncertified biomedical device, by providing a signed declaration. Whereas the effectiveness of the project, we decided to urgently patent the link valve, Charlotte valve, to prevent any speculation on the price of the component. We clarify that the patent will remain free to use, because it is in our intention that all hospitals in need could use it if necessary. The Charlotte valve is available to be printed by any hospital unit that needs extra ventilators and can get supplied with the snorkeling masks it can fit. A different team of doctors from Bologna and Milano, together with Intersurgical, a factory that makes advanced mechanics in Mirandola, invented a device that splits a ventilator, makes it usable by two patients at the same time. The adage, necessity is the mother of invention, can aptly be used to describe how individuals and institutions are coming up with innovative ideas to fight COVID-19. Below are some of COVID-19 specific innovations. Full body disinfection chamber, 1, developed by DRDO. 1. Quick and dirty ventilators, Virgin Orbit's squeeze bag ventilator. A simple but effective ventilator from a windshield wiper motor and pliable AMB-UBAG hand-operated resuscitator. This one is going to basically be for all the patients who need a ventilator but do not need a top-line ventilator. 2. Detecting people with fevers in large crowds, Skyla, an AI company, sells image recognition systems that, among other things, detect guns held by individuals in large crowds of people, has adapted their thermal imaging AI algorithms to identify which individuals in a large group, for example, in an airport arrival zone, have fevers. 3. Monitoring compliance with social distance guidelines in real time, to identify which regions of the U.S. are and are not maintaining social distance. By analyzing the separation between adjacent handsets, UNCAST can tell how far apart people are staying from each other across the U.S. 4. COVID-19 Symptom Tracker App. Harvard and Stanford medical schools have teamed up to quick launch an app, COVID-19 Tracker for iOS and Android, that allows public health and medical professionals to monitor disease hotspots in order to decide where to focus scarce resources and plan quarantines. This app-based study is a way to find out where the COVID hotspots are, new symptoms to look out for, and might be used as a planning tool to target quarantines, send ventilators, and provide real-time data to plan for future outbreaks. 5. Face mask made from heater, air conditioning filters. Daniel Joseph, a designer at Walt Disney Imagineering, has invented a simple face mask that uses abundantly available heater, air conditioning filters. 6. Custom-fit eye protection for healthcare workers. In addition to a mask, healthcare workers need eye protection to prevent small droplets of fluid carrying the virus from reaching their eyes, eyebrows, or eyelashes. Using a mobile app that quickly captures facial features, to design and print custom eye protectors for healthcare workers. 7. A proximity alarm that discourages you from touching your face, a device called Face Fence that sounds a gentle alarm when you start to touch your face.